Hi everybody, Dr. Kirk Johnson with Johnson Chiropractic and Acupuncture. So one of the videos I did last year, we talked a lot about the differences in food allergies versus food sensitivities. And that was a really popular video because, food allergies are something that's, requires an EpiPen, it's an anaphylactic type reaction. And a food sensitivity is something that's causing or creating inflammation in your body, mostly starting in the gastrointestinal tract. And then as that inflammation gets out of hand, we get issues and we get systemic inflammation, which can contribute to many, many other different health conditions. So food sensitivity testing. So there's really a couple different options to understand and to find out what foods are causing inflammation in your system or wreaking havoc in your gastrointestinal tract, and what can be contributing to other health issues that you may be having. So one of the ways we do, I'm certified in applied kinesiology, which is manual muscle testing and correlating that to different avenues in the body to understand, okay, does this need to be adjusted chiropractically? Do we need to do acupuncture? Do we need to do some nutritional protocols, some nutritional supplements? Do we need to take away some certain foods that are contributing to the issue? So one way, and I have about 70 foods that I test here in these little vials up here behind me that you see, and we do that through applied kinesiology testing. Now you'll hear a lot of people do, nutrition response testing or some kind of muscle testing. They've taken, 1 weekend course on it, and there really needs to be a little bit more in depth than that. I have over probably about 400 hours in applied kinesiology training, and so we can really understand how to do the muscle test properly and how to correlate that and then correlate it with the symptoms that the patient is having. However, if you don't want to do the applied kinesiology route, there's a couple other test procedures that we use. So the most common food sensitivity test is called an IgG test, or immunoglobulin G. So you present the antigen, which is the food, to the immunoglobulin pathway, or immunoglobulin, and see if it creates an antibody. So that is one way to do it, and we offer that testing through a lab called Vibrant America, and that test is a very good test that has 96 different foods, and that's actually IgG and IgA food sensitivity testing. Of those 96 foods, then we will look and say, okay, you are positive, or you have a mild reaction, a moderate reaction, or a severe reaction to this food. Therefore, you need to pull that food out of the diet and see if we can calm down the GI tract. So that test usually runs, I think it's $249 for the 96 foods. So that's a really good test. It's reproducible. It's been proven to be accurate, so then we can go and have a better plan for the patient instead of saying, you just need to change your diet, and we don't give them any good direction. You say, try to take out these different foods. Well, we need to know what food personally for that patient is causing and creating issues in their body. The other testing we use it's through Cell Science Systems. It's called the Alcat test. I've used this test for years. It's more along the lines of what they call whole white blood cell morphology. So instead of just testing one immunoglobulin pathway like IgG or IgA or IgE, it's kind of testing how the whole white blood cell would react to the food or the antigen. And it also has some expanded tests as far as, the IgG test was 96 foods. We can go all the way up to about 237 foods on the Alcat test, which is really important. I had a patient years ago that kept coming in with stomach issues, and we finally ordered the Alcat test, and since it has so many different foods, it was amazing that she came out that turmeric and curcumin were causing issues in her body, and she happened to really like Indian food. So it was a huge surprise to me, for one, because that's usually not something you see people have a bad sensitivity to, but she did, and we figured that out, and we were able to pull that out of the diet and get her feeling a little bit better. So that's one of those things. You might be reacting to some foods that you think should be healthy for you, but unfortunately for your body, they're not. The other cool part about the Alcat panel is they have functional foods and like herbs that you can test as well. There's food additives, there's preservatives. They can even test antibiotics, anti-inflammatory agents, molds. What else do we have here? Oh, and a bunch of different herbs as well. So you could look through and say, for example, I take Lohan Go, or I take St. John's wort. Well, if you take those products, we could check and make sure that you're not having a reaction to those products in an inflammatory or a an immune reaction to taking these certain herbs that are supposedly good for you, but they might not be good for your body. So this kind of goes in the part of, whole health, whole body health, holistic health. We need to look at everything to be able to treat the body properly, because if you have recurrent, even low back pain, which I see a lot as a chiropractor, a lot of times you pull a product or a food that they're sensitive to away, and that inflammation decreases in the whole body, the back pain starts to resolve and you get a lot better results. So if you're interested in any of these tests, I'm going to put some links at the bottom here in the comment section, and I'll link to those different websites so you can look at the tests yourselves. But if you want to book a test or talk to me about one, please give my office a call. You guys take care, and I hope you learned something about food sensitivity testing. See ya. See ya, Michael.